So those are some of the major things I think that I'll cover before you start asking questions, because the most important part is the questions. So I will check my phone and just see if there's anything that we've gotten online so far. So folks online, please do actually write questions in there. But we have 2 mics, so if you have a question, please raise your hand, and Mike will be the micer. And hopefully I can, and if I cannot, that means I have more work to do, which I already know. I have more work to do. So.
I've never used one of these before, so it's a little weird. Okay, so my name is Rochelle, and I have Tourette syndrome. I am disabled through the SSA with Tourette, and Michigan Medicaid does not seem to be able to cover any doctors that can treat adults with Tourette, and there's really not many in the state of Michigan that treat it. There are Tourette centers of excellence that are outside of the state, but my insurance will not help with me going to see them, even though I'm disabled with this disorder. And the Social Security Administration keeps telling me to go through my insurance. Is this something that this policy would be able to fill the gap in? Would somebody like me be able to travel out of state to a Tourette center of excellence to get the care I need? Because right now, all they're doing are Band-Aids. Like, all my treatments are just maintaining things, but nothing's helping me get better because there's no doctors that can treat me here.
Thank you for this question. We have never gotten this question. So there's 2 things I will tell you. One, specifically about the condition of Tourette. If we don't have providers in the state, it seems reasonable that this would be able to cover you receiving that medically necessary care, even if it's outside the state borders. The question we get at every town hall is, does this cover me if I go out of state, right? We have snowbirds, all y'all aren't here. Some warm tropical location. We would have to figure out how to make our payment in Michigan cover things out of state. And that already happens right now with people who are snowbirds or who otherwise travel out of state or even travel out of the country and need payment for their coverage. So there are models and examples of how to pay for things out of state. The other thing I would say about this is that if we do have a guaranteed minimum payment rate for services, depending on what kind of treatment and services you get, there may be physicians or other providers who might actually just want to live here because we might actually pay more than what they make elsewhere. But that is something that I can't guarantee with this at this point, but it is something that I would hope to see over time is more providers moving or staying in Michigan because they know that they'll get a minimum rate. And I don't know if there's providers in the room, but when I talk about 150% of Medicare, a lot of providers are pretty impressed because that's a lot better than most providers for most services right now. So thank you for that great question.
Thank you.
So looking at this, the 150% of Medicare, what does that mean? Like, does it mean that that's what the provider gets reimbursed, or does that mean that we pay out of pocket? Or I'm just confused about what that means.
That's a great question. So right now in the United States, we have kind of 3 buckets of the ways people get their health care paid for, right? You can pay directly out of pocket, right? That's kind of a 4th way. But the 3 kinds of insurance people have is either government insurance, which is Medicare, or Medicaid. Here in Michigan, Medicaid is different than Medicare. Remember, Medicare covers people 65 and older for the most part. Medicaid covers people who are low income. Sometimes people are both. And
Medicare also covers disabled.
They do cover some disabled folks, but not as many as they could, in my opinion. So those are the publicly covered options, and commercial insurance through an employer is the way most Americans and most Michiganders get our health care, is coverage through our employer. And then a small amount of people get coverage directly buying it from an insurance company, which is commercial insurance as well. Providers, they know that commercial payers tend to pay the most for services, then Medicare, then Medicaid way down here. Sometimes Medicaid doesn't even pay enough for the lights to be on. In, for example, a dentist's office, when you're in there, they don't even reimburse enough for them to like walk in the room in the first place. So a lot of times providers, when they hear that what we're proposing is if you as a provider are contracted with MiCare as the payer, you will get paid 150% of the Medicare rate. And often that puts it above even the commercial rate. So a lot of providers are happy to hear that because through their contracts with the payer, which in this case would be MiCare and pretty much only MiCare in Michigan, there would not really need to be private insurance in Michigan, except for possibly a group of folks, which I can talk about in a minute. But that's what that would mean, is that the payer or the provider would know how much they're getting paid for those services.
And you're doing it just so that you don't piss off all the providers. Is that why? Or I just don't know. I'm just trying to figure out, because why would you off? Because it's just going to cost the state more money. So why not offer them less than 100? I don't know what the reason. What is the reason?
Yeah,
Just
so
to not lose providers.
In the past,
Yeah.
this bill had it at 125% of Medicare.
Right.
We got feedback that it should be higher, so we put 150% in. That's a floor. The board can decide to pay more if they want. We can also, which is another question I've gotten at other town halls, we can also not use a fee-for-service model. We don't have to pay that way. We don't have to pay every time a provider does a thing, because that incentivizes providers to do more things, right? So maybe what we can do instead is say, hey, you're a provider of this kind of service, you see approximately this many patients with approximately this many conditions, we're gonna pay you a salary that evens out to about 150% of Medicare. But that is not for me, Carrie Rheingans, to decide. That is for 13 board members plus probably like 200 actuaries to figure out.
And that is being consulted with providers to make sure you're not going to lose them.
Oh, yeah,
yeah.
So, I mean, the politics of getting to
I imagine it's huge.
identifying these minutia is a long time from now.
Right.
And there'll be a lot of fights between now and then. But we want to hear from providers about whether this seems reasonable or not. But when I talk to providers and they say, oh, right now I have to get on the panel of 17 different payers, their paperwork and their paperwork and their paperwork. And in this world, I can just contract with MiCare and get paid more than I do now and have less paperwork. It's like incomprehensible.
Right. And then, okay, so then one more question. As far as like getting this across the finish line, I mean, there's things here like dental care and vision care, which are very nice to have, but
They're not nice to have. They are.
I don't have either, and I haven't had either for years. But I'm just saying.
I don't think that
they're super
extra.
nice to have, and I'd like to have them. But I'm just saying, if it just gets us over the finish line without having those, I'd be for that too. Like
I would not.
Yeah. But I wouldn't. I mean, I'd love to have both of those, you know. But like, if it can't, you know, just anything to get this over the finish line. Right now, you know, I'm paying, you know, $800 a month for a $7,000 deductible. And, you know, with zero health, zero dental, and zero vision, and, you know, and I'm fine with that, but just something to get this across the finish line. And I'd compromise on other things to get it across the finish line. So that's all
I
I'm saying.
appreciate that.
Yeah.
Thank you for being willing.
Yeah.
I just want to know, like, for disabled people, she mentioned, okay.
There's a third question.
I'm just curious with the MiCare.
Yeah.
You said 65. What about people that are disabled and having trouble just getting care?
Yeah, so there's two parts to your question. You're asking in part if you're disabled and you're on Medicare right now,
Right.
would you still have Medicare to cover those services that it already covers? Is that part of what you're asking? Yeah, so Medicare's dollars coming into Michigan would go into the MiCare Trust Fund, and you would then not be on Medicare, you would be on MiCare, okay? And MiCare would be able to cover more things than Medicare. And since our state does actually provide a lot of publicly financed disability services already, not enough by far, there is an infrastructure upon which we can build more services. The other part of your question that you didn't explicitly say is, there's not enough services. How do we make sure there's enough services when 10 million Michiganders suddenly can actually afford to get health care? And that is a huge problem. We already don't have enough services and providers in Michigan already. I will say there's, some debate on some of the numbers. For example, we have over 50,000 nurses that are registered and licensed in Michigan that are not working because they refuse to work in certain working conditions.
Right.
So we do have physically some amounts of providers in our state, but they're not working in these conditions. But we still do need to bulk up all of the provider types and all of the service types. And that is a huge problem, not just here, but across the country. So that is something that excites me about MiCare. The bucket of money could potentially be used also for payment incentives for people to move or stay here, help pay for student loans, or help finance some education for providers. But for MiCare to be as fully enrolled, cover as much as we want it to, and actually show population and health improvement in our state, it'll take over a decade. So between today and MiCare passing and getting signed into law, it might take a decade, and then it still might take a decade for us to see the changes. Which,
So at least didn't bury it at that point.
Yeah. I hope not.
You get that, yeah.
My name is Jennifer Kohler. I reside in Macomb County. I'm one of those individuals that lost Medicaid about 1.5 years ago, being told that I make too much money, $14 over the threshold. I lost my dental, which is imperative, by the way. It goes to your heart. My teeth are literally rotting out of my mouth. And Medicaid was paying for those services rendered, which was cut short. I also have had 4 back surgeries. I've been with my provider for 15 years. I've driven from Tuscola County, Huron County, and even from North Carolina to see my provider. I've known him for many years. It's just, and my husband, he served in the United States Air Force. He's in the VA, he's stage 4 kidney failure, which is difficult. And he had the Medicaid as the TRICARE, which it was cut. And you cannot get a hold of anybody in Department of Health and Human Services. You no longer have a caseworker.
In the state-based.
Yeah.
Yeah.
And you can't appeal it. And when you try to appeal it, they're nasty to you. And I only make $14 or $4 over the threshold. This year, I got an increase of a whopping, are you ready for it? $8. And my premium went from $170 to $202. Tell me, how do you make it work? It's 2 weeks into the month and we are broke.
I'm so sorry. I'm really sorry about, you guys have a lot of health issues going on. There's a couple of things you mentioned there. Medicaid kicked you off in 2025? 2024?
It's 2024.
Because you came over the threshold for income is what they're saying. Right?
Yeah, they said, oh, we let you slide during COVID, but now you have to figure it out on your own. Go get a Medicare Advantage plan, which, by the way, you lose your doctors. I don't care what they tell you. And then they cut your medications.
Yes.
I didn't dare.
So are you on both Medicare and Medicaid right now?
I'm
Or
on
are you
just-
not on Medicaid anymore? You're just on
I'm on
Medicaid?
Medicare and I have a premium and I have a deductible, and every time I go in the doctor's office, I'm down to 1 doctor. I can't even get my thyroid because I can't afford it. I can't see a dentist, which is affecting my heart.
Yeah. I understand that. I'm really sorry about this. You are saying something that I've heard from a lot of folks in Michigan is that when you call the local DHS office, which in Michigan is part of our Health and Human Services Department, most counties have an office where you can call and get a caseworker to help you work on your healthcare stuff through Medicaid. They have lost a ton of staff, and there's a lot of problems there that we have been hearing about. I mean, I don't know how much you guys hear about it in your office, but we hear about it in our office, that department needs some overhauling of processes and services that they do within those local offices. So I hear you, and I agree with you, and I hear it from a lot of people. With Medicaid, the one for lower income folks in Michigan, and how it's different from Medicare. So you're still on Medicare because of conditions and maybe age, I'm not sure. But so There is the issue of buying additional supplemental insurance, and those are insurance products that are made for profit by
Right.
for-profit companies, and they purposefully choose to only contract with a small number of providers in order to make more money. So that's why they are like reducing the amount of options you have for providers, so that those Medicare Advantage companies can make more money. And then you are correct, in Michigan and across the country, under the COVID emergency, there was the ability to not have to up your income every year, or every year, to stay on Medicaid. Unfortunately, the Biden administration did rescind that and make people start re-upping their income every year. And the one big, I call it one big bullshit bill, but
Oh, I
one
got
big
better names for it.
beautiful bill that now makes income validation every 6 months, not every year. So they're working hard to kick people off as more often as possible.
Yeah, people are dying and they don't have so many people to care about.
And if you are a person whose mind thinks about how to make the most money, the more people who die, the more money you don't pay out.
Yeah,
And
I'm
you just
against
keep-
those people.
I am too. They are okay with people dying because it helps them make more money, is what I'm trying to say. So, is Mike your state rep? No, you live in Macomb.
I have part of the
Okay.
Harrison.
Oh, no, that's St. Germain.
Okay, so we can talk to you afterward and make sure you get her contact info, because she could possibly also help. Sometimes, one thing that people might not know about your state lawmakers is when you're having trouble with a state department, whether it's unemployment or DHS or other state departments, you can contact your state lawmaker and we can actually call them and they suddenly are like, oh, yeah, we'll work on your problem. So hopefully Rep. St. Germain might be able to help you a little bit with some of that. But otherwise, your story is very common and part of an example of that demonstrates how our healthcare system is completely crumbling right now. And you don't deserve that. You're a person that deserves healthcare because you're human.
Nobody deserves that. And honestly, about 15 years ago when I was living in North Carolina, we were the envy of the rest of the country here in Michigan because of how proficient it was and the Secretary of State. Because we were efficient. I don't know what happened. Someone dropped the ball and the answers need to be given.
I do have No, he's going to sign his question, yep.
Thank you. Hello, my name is Teddy. I'm from Detroit. I have a hearing loss, and I know that there are many in our state who likewise have hearing losses. And I'm looking in this and I'm wondering about what type of hearing care would be provided for. What type of coverage that would offer, because I'm not sure if you're aware currently, as of last year, we have been trying to ask for hearing aids. There was a bill that we were working on getting passed for hearing aids for children who are under the age of 18. But now you're talking about MiCare and having that, including hearing services. I'm wondering if you could expand on that and explain like what those services would include and for what ages. If that would take care of children, adults, if it would take care of hearing aids, that type of stuff.
Okay, thank you. That's a great question. So the difference in services and devices is part of what I mentioned earlier. We do intend for medically necessary services and devices to be covered. So that's where I, as a person without hearing loss that I know of, need help figuring out what it is that we should be pushing for and making sure that what is medically necessary is covered and for the appropriate ages. This is a big gap in Medicare also, which is for the 65 and up. That doesn't cover hearing aids the way I think it should. So this is where I would need your help to figure out what is best to do and make sure that the board, the MiCare board, actually puts in coverage for things that really are medically necessary.
That's great, thank you so much. I would love to be able to talk with you more about this and figure out how you plan to support that.
Okay, thank you very much. Great question.
Okay, I'm trying to understand this. This is just for Michigan, this plan,
Correct.
not a national plan.
Correct.
What are isn't there going to be some problems with the regular insurance companies lobbying against you guys? Big time? Yeah, like, I know it's a stupid question.
It's
but-
not a stupid question.
I know that.
It is-
that'll do.
so this
What
is-
about nursing home care? Will
Yes.
that cover that?
That is something, so in the bill, and I have a couple questions coming in online. I'm not forgetting about you virtual people. In the bill, at the very end, in the last couple pages, we list 3 things that we need to make sure we do more study on to figure out how to include them. Not to figure out how to exclude, but how to adequately include them. They are how to deal with the long-term care needs of people with traumatic brain injuries and other catastrophic things that result from car crashes. Right now, that's something that's not covered the way it was previously until, like Mayor Duggan really pushed this auto reform thing that didn't lower auto insurance really for a lot of people, but it also kicked off a lot of people from medical care. So that's one thing we need to deal with. Another thing is workers' comp. And if a person gets injured on the job and they need some medical care or rehab or something, MiCare should cover that, but how do we work that out with current workers' comp insurance? That's one thing we need to study. And the third thing is long-term services and supports. So you can imagine the kind of tragedy of the commons, and I kind of just went through this with my dad who died on January 4th, but before that was in and out of nursing homes, in and out of assisted living, hospital over a year and a half after he had a stroke. And my sister and I were kind of fighting him to get him in the right location, but it was very expensive. And Medicare only paid for certain things, and then you had to pay out of pocket. And so you could imagine a world where if we say, MiCare will cover your long-term care forever, as soon as somebody gets on the verge of needing long-term care, middle-aged people like me with little kids are like, bye, Grandpa. Like, get your butt in there because it's way easier, and that's very, very expensive. So, and I'm saying that, like, of course, definitely crossed my mind. I love my dad, but I was like, dang, guy, this is a lot. So we do need to do some studying on that and figure out how to adequately cover that and not put up too many barriers and make sure people get the care they need and that the workers who work there get paid adequately, because that's one of the biggest problems that we have.
I'm not retired already.
Okay.
I worked in nursing home and hospital.
Well, I think those people need to get paid more, but yeah.
But I was going to.
So it is one of the things we still need to figure out.
I know.
And it is one of the,
Oh, and one last thing about the ages of this plan. It starts with little.
as soon as you're born in Michigan, or you come here, after 6 months, you are eligible, and then you should be eligible to die
Okay, that's all.
while you're in Michigan, right? So like, while you're a Michigan resident. So we do put in the bill that we want you to live here for 6 months before you're eligible, because we want you to be paying in a little bit. But obviously, if you're born, we're not gonna make you pay, right? But also, that's where we might need a sliver of private coverage or a buying in option. So you could have 6 months short-term coverage until you get eligible for MiCare, or, and this is not in the bill, we have not yet figured out this quirk, or maybe you could pay a certain amount every month to buy into MiCare before you actually are eligible without having to buy in. So that's a sticky wicket that we still need to figure out.
Right.
Yep.
Okay, thank you. Real quick before you ask your question, she has a couple that are online.
Thank you.
One question is there any personal income taxes, or is this all business side payroll taxes? This would be a payroll tax of the individual with their income. It would be an income tax on your income, but it would go through your business just like a regular income tax, right? So like right now, we pay Medicare payroll taxes. And those Medicare payroll taxes are paying for everybody's Medicare who gets Medicare today, right? So that's kind of the same the same idea, but we do propose that businesses also pay a business tax to keep their employees healthy. So it is both.
But they would have to provide insurance.
Correct, they would.
It's a very big expense for business.
Yeah, and it's disproportionately a big expense for the smaller businesses too. So that's why we want to kind of flip that and make smaller businesses pay a smaller graduated tax and bigger businesses pay a bigger graduated tax.
Real quick. Something else that a lot of people don't realize is that one of the biggest beneficiaries of the ACA or Obamacare are small business owners. Like, a lot of small business owners rely on that because usually they're just one or two people, possibly, maybe just themselves. And a lot of people don't realize that because things like this could actually spur entrepreneurship and spur a lot of other things because you no longer have to worry about whether or not you have health care. So I just wanted to add those 2 cents.
Thank you for the water break. What about gig workers? For example, does DoorDash pay or the Dasher? So in this case, DoorDash to operate in Michigan would have to pay a business tax. And the Dasher, if paid through like regular income, if they take out income taxes, part of that income tax would go toward the MiCare Fund in Michigan. So it would be both. And then there is a question about where can I find the bill. Thank you to my staffer who put that link online. So if you're online and looking for the bill, it is linked onto that live stream, but also for those of you in the room, if you just look up in a search engine, MiCare Michigan or Michigan Legislature House Bill 4407, you should be able to find the bill itself.
We'll also post it on We'll also be posting it on my social media. Probably after this tonight, there will be a link. If you cannot find it, just reach out to my office and we'll make sure you get it too.
There's a couple more, we'll take.
Oh, go ahead.
Oh, okay. Please, when you're writing this bill, make sure you discuss method of treatment. And people may not realize, but last April, Medicare decided to stop all video calls. So I no longer can do a video call with my doctor. Well, like 5% they'll allow the video call. I'm a disabled senior citizen. It's very, very difficult sometimes for me to get to the doctor, especially when the whole appointment is 10 minutes. Because my endocrinologist, I had to talk to them once a month for a prescription renewal. The whole thing takes 10 minutes. But Medicare will not pay for the video call. They'll only pay for a person call, so I would drive there, sit in the waiting room, and wait for my 10 minutes.
That sounds like fraud, waste, and abuse that has been put upon you by the Trump administration changing this rule.
Well, the cost of a video visit is billed at like 20% of what an in-office would. So it's actually costing Medicare and the taxpayers to have this law now. And it's ridiculous. So please make sure this talks about, can we do video visits? You know, do you cover emergency care? Do you cover, what do they call that when you just go to CVS and they add that kind of call?
The point you make about making sure that telehealth is included, our bill does not actually have a lot of specific explicit content in the bill itself right now about telehealth, in part because philosophically it's, in my mind, medically necessary, but maybe putting something in there so that it is required will protect that to make sure it has to happen. So that's a good flag. And then emergency services are covered. And then you mentioned like pharmacy. Pharmacy is covered as well.
Pharmacy's covered.
Yep, yep.
But we really need telehealth.
Yeah, I agree.
Badly.
Yeah.
Thank you. Thank you for bringing that up.
Maybe a couple questions. First of all, say this bill does pass and get full into it, and you're on vacation, you get injured out of state. Will the care you get in, like, say you go to Colorado and you break your ankle, going on the hiking trails or something? Will they recognize that you're on MiCare in your home state of Michigan, and will you be covered out of state, or will that be a whole nother ball game that we got to play?
Yeah, so this is going back to the question about coverage when you're out of state. Right now, there exist payment rates for insurers that say if you're in your area, this is how much we'll cover. If you're out of your area, here's how much we'll cover. Sometimes it is around actually the network of providers itself, but it could also be about geographies. So there are examples of how we could do this. For us as a state, we don't want to be out there saying like, if you're in Ron DeSantis's Florida, we're gonna pay a high amount to his hospitals, because he might want to build Michigan and just drain our coffers, right? Bless his heart. So we could put out some sort of payment list of like, if you're out of state, this is what we cover. I would like it to be covering the cost that you incur, but I wouldn't want Colorado, which you mentioned, to charge us extra just because they think they can. So we'd have to figure out a way in contracting to do that and do our damnedest to avoid you being on the hook as a taxpayer in Michigan who should have access to this healthcare coverage.
And I was also wondering, could you elaborate a little bit more on how this bill would affect like our deductions in paychecks? Like, will we be paying into like the national Medicare anymore, or is that out since we're paying for our...
Yeah, so this is a good question, and one of the things that we need to work out between the state and the feds. So in the U.S. Congress, Senator Ed Markey from Massachusetts and Representative Rocana from California have introduced a bill in each chamber called the State-Based Universal Healthcare Act, SBUHCA. They call it SBUCA. Just a terrible act. Bless it. But so if that bill passes in DC and gets signed into law, which it will not right now, but maybe next 2 years, 3 years, if that gets signed into law, it would require the federal government to approve state plans like ours and to approve our request to use federal dollars and use those Medicare payroll taxes. So we could continue to pay Medicare payroll tax to DC, and they could then allow us to use it for MiCare. We could also just cut out the stupid middleman thing and just not pay Medicare payroll taxes and instead just pay a MiCare payroll tax. So that's something that would have to get duked out as that time comes. So great question. One of the questions from online is about networks. Will the network be very narrow, limiting access to care? So another part of the question was, is every provider in Michigan required to take MiCare? So right now the way the bill is written is not that providers would be required to take this, but it would be beneficial to every provider to reduce the number of panels that they're on and health insurance companies they contract with, and just stick with MiCare, because MiCare will pay a pretty decent rate and will be a lot less paperwork, because basically if you're licensed by the state of Michigan, you're on the panel, so you don't have to do separate paperwork to get impaneled on that health insurance. Right. So the idea is that pretty much every provider in Michigan would take this. There may be some that completely opt out, like they do now, just take straight up cash only from their patients. So that is something. So that would be, this person also was asking about, I had to call everybody, call the facility, call my doctor, make sure they're in my network. That is way too much of a waste of time for you as a patient to have to do when you are just trying to get the care you need. So we would need to make sure that we list everybody who's in the MiCare network, which would pretty much be everybody. So hopefully that would lessen the amount of work an individual patient would have to do. Well, have you asked a question yet? In the back, did you have your hand up? Oh, no. Never mind.
So I have one more question. I have a grandson, he's 8 years old, and he has something called spinal muscular atrophy. He was born with it. My daughter is a diesel mechanic in Saginaw. Right now, she does not get health care for herself. And when you have a child that you have to take care of, you have to make sure you're healthy too, to be there for that child. And so, he goes to University of Michigan every 4 months to get a stem cell in his spine. He's been doing it since he was 2 years old. So in the way of like experimental research that is, a patient depends on to live and survive, how does that work? And can we make sure that our caregivers are insured so that they're there to take care of us?
So your daughter, I'm guessing the mechanic would be covered by MiCare just by living in Michigan. And so would her son, your grandson. If there is an experimental research project like this, which unfortunately billions have been cut from that, from the federal government in 2025, but that type of research might have a different funding stream that is covering that care, and therefore MiCare would not need to cover that. Also, I have no idea which way the MiCare board eventually will go, but there will be some sort of determination of what things actually, like which exact treatments are covered, and they'll have to determine what medical research they use to say, yes, this is medically treatment we can cover, or this is still experimental and we don't cover it. So that's something that the future MiCare board will have to figure out. But right now, with the way it sounds like it is, it's a research project that is covering the cost of the stem cell, but the mother still needs coverage.
Right.
Has she tried calling DHS? Or applying?
She's tried, but it's like very difficult to get a hold of anybody.
Okay.
And they keep punishing her and taking money from her. Or depending on how much she makes, they cut his check from Social Security, which he gets.
Yeah.
This is a problem.
Yeah. Yeah.
And it all goes back to the orange blob.
This happened before the orange blob. This has been a problem with social services before the orange blob. We should talk after about that specific situation to see if there's a way we can help your daughter.
All right, thank you.
Another question from online is about clawbacks. So for folks who aren't aware, sometimes, as of today, in this current health insurance environment, an insurance company can pay a provider for their service. Maybe they pay too much, but they don't realize it for like 3 damn years, and then they pull the money back. And the provider sometimes is like, wait, what? And maybe they pull all 3 years of their mistakes back at the same time. So that can really harm providers. And so this person is suggesting, can any clawback be limited to 1 year? I like that idea, thank you. And how long will providers have to bill? So that is another thing that we need to figure out. And this is why I say the MiCare board is gonna have to hire literally thousands of people to figure out these detailed processes. Fortunately, in my opinion, we won't need all these private insurance companies that we have in Michigan. They will not exist. Some might a little bit, but they're gonna have to lay off like thousands of workers that MiCare can hire. And in fact, in our bill, we give preferential treatment for MiCare to hire people who are being laid off from these health insurance companies. You heard I worked in health policy for a long time. I have friends who work for health insurance companies. They're not the devil. Like, the people that work there are working there because that's the only way you can pay for care in this United States of America. So they want to help people get health care. The CEOs want the profits. So we want to hire those people and have them work in MiCare. And I think they would set this policy. But 1 year limit is a good idea, person online.
Sorry, I have to get my balance. I'm 83 years old. Hi, I'm Professor Wesley Arnold. Let me face the crowd. I've been a college professor for 30 years, have a lot of students, have a lot of experience. First of all, I want to thank you three very much, Chang, Paul, and this young lady. Thank you very, very much, and thank you for your persistence in bringing this up again. This is something that is very much needed, and of course, I think you mentioned the seniors. But a lot of people don't realize, even with Michigan's so-called medical coverage, used to be called ABC. I used to be a social worker for 14 years. We still have a lot of kids that are falling through the cracks, that are not getting proper care. And there's a lot of young families that are not getting the proper care for their children. And so this is very much needed. Thank you again for working on this. Michigan has some of the most expensive health care in the world. Well, as does the United States. People are spending an average, according to one little thing I've got here, if anybody wants a copy, something like $8,000 a year. I think a lot of people are spending a lot more than that. And healthcare spending has been rising. Wow. So this is very, very much in need. And one other thing that I just want to mention shortly is there's a lot of groups out there that might be able to help you. Like I'm a big shot in the VFW, and even though we have quite a bit of care from the Veterans Administration, these people have families. And so I think you can, if you get this publicized more, you can get, there's a lot of us that would be glad to help you out. So thank you very, very much. And you know, what is it here? I got it under my thumb. 72 countries have found this to be workable on a national basis. So I'm sure that Michigan can make this workable. And instead of paying $8,000 a year, maybe it's going to cost us $1,000 or more per person. But if we tell them the math, a couple thousand is a lot less than 8,000. So I think this is workable, and we can make it happen. Let's do it. Thank you.
Thank you. There are a lot of groups that we're working with. A lot of people ask what they can do to help. You may see on the back of your brochure, there's a list of groups that already support MiCare, who passed like resolutions or otherwise had votes in support of MiCare, this bill specifically for the state of Michigan. We have about 10 million people who would be paying in and then receiving services. That's more than some countries that have universal health care. So I will say the numbers are big enough in Michigan to spread the risk of health care services around for the amount we pay in. We have not yet exactly determined how much any individual would pay. So the financing bill or bills are not publicly available yet. We've been working on them, and I've been working with other states to figure out how to get that financing to work properly. Our state, we have this bill, but there's about 24 states that have introduced state-level bills. For example, Maryland and Colorado, I've been talking to a lot. Each of their states only have 5 million, and they're wondering, is that a big enough pool of people to pay in order to cover those services? So New York, meanwhile, has 20 million people, and their bill would use only state sources, no federal sources, to cover this. So, you know, there's a lot of cross sharing, and I've been organizing all these states. We met last night at 8 p.m. because we're in the Eastern time zone. So to get everybody, even in Hawaii, we have to meet really late at night, but to talk through some of our bills and how we're organizing across states, because there is the Medicare for All movement at the federal level, which will cover 330 million people in the whole country, which is a great risk pool, but that has not politically been feasible. MiCare is not yet politically feasible in Michigan. This legislature would not pass it. Even last term in the Democratic trifecta, my bill, I actually got asked not to introduce it. But I still did because it's the reason I ran for office. So I think we have a chance in a coming term, maybe next term, maybe the term after, for us to really push for this. And that's why I'm talking to all of you now, today, even though this bill will never be hearing. This bill will never get a vote this term. But I'm a member of the Michigan House of Representatives, and who is the person who decides what bills get hearings and votes is the Speaker of the House. The Speaker is elected by the majority. Michigan House is controlled by Republicans right now. So the Republican Speaker of the House, Matt Hall, would never give this bill a vote or a hearing. Even though he's trying to talk right now about lowering healthcare costs in Michigan. I have a bill right here for you, buddy. But yeah.
So I know there's probably someone in the comments on Facebook Live that is going to say, I don't want to pay for this because I don't want to have to pay for other people. I encourage you to Google how insurance works, because you're already doing that. And I can guarantee someone is making that comment, because I've gotten several of those comments just sharing, promoting this event. So I just wanted to add that while we were talking about the financing of this, that that's actually how insurance works. So, thank you.
Yes, thank you. I do have another question. I'm wondering whether the legislature has thought about how this bill would impact specifically people in the deaf community who depend on sign language interpreters for linguistic access, and how they would have communication access when they went to see their providers. Not only to see doctors, but like also for emergency services as well. So I'm wondering if this is something that the bill would address as far as communication access for those of us who need that. We need more interpreters. In hospitals, we need more interpreters. We need better services. Very often we end up hearing comments from providers saying, well, we don't have the money to pay for providers or for interpreting services. That's too expensive. It's a professional service, and I'm trying to make sure then that there would be support for patients who depend on having interpreters for their healthcare provision to actually get that access that they need.
Thank you. So you're asking specifically about interpretation for received medical care and medical services. Those medical care and medical services would be medically necessary, and therefore being able to understand what the heck is going on is medically necessary also. And that is both for people with hearing issues, but also other languages. We need more interpreters of other languages in these kinds of settings as well. And that is an essential service that enables medically necessary medical services. So it's not written in the bill. This is why I'm doing town halls, to hear from people like you. So thank you for bringing this up. But it's not written in the bill right now, and is something that needs to be considered as we roll this out. So maybe we can make an edit to put that specifically in the bill with professional services such as language access to be something that we include in the list of required services. So thank you for bringing that up.
Right. I have an adult young son with spina bifida, and his last wheelchair, even though we had Blue Care Network, we still paid 50% out of pocket. So it was thousands of dollars because he needs a custom made, because when you purchase from a store, you can't ambulate yourself because of the, it's not proper that you can't ambulate with it. And also orthotics, also 50% out of pocket, even with Blue Care Network. Does that fall under medical devices?
So that kind of thing should be falling under medical devices. Blue Care Network may not cover that because it's really expensive and they just can't make the math work. And they claim it's not medically necessary. So I guess I want to live in a world where your doctor and you as a family are the ones that decide what's medically necessary. I don't think any health insurance company should decide that. So, and Mike has a bill on that. So that's something that we do have the intention of making sure is somehow clearly spelled out and put into the actual rules rollout of this. I mean, this is going to be the single largest thing in our state budget. It might need to be a whole separate department. It will have thousands of employees. I mean, this is the kind of thing where promulgating administrative rules is going to take a couple of years to define certain things like that and define the processes by which we confirm that the patient and the family are the ones deciding what's medically necessary, not MiCare, not politicians, not the MiCare board, but the patient and the family.
Okay, I have one more question. And this may have been touched on, but there's been so much that's been talked about. So almost 2 years ago, I was hit by a car and I sustained permanent damage. And my insurance company will not cover the cost of the surgery or anything because it was due to someone else's negligence. So I'm about a year into a lawsuit because we had to file a claim against his auto insurance, and then when we filed with Michigan PIP, it was denied. And so we're currently in a lawsuit against them as well. And I'm now past the threshold to actually have the surgery, so now I have permanent damage in my right arm and loss of function on top of my Tourette that my insurance will not cover the doctors for me to see out of state. I've actually thought about moving out of the country to get health care like this gentleman in front talked about how it's feasible everywhere else, because I'm afraid that this is going to be the death of me. not having the proper treatment and constantly getting denied, and then I'm still young, and so what happens if it's someone an auto accident or you're seriously injured and your insurance company's we're not covering it, and PIP's we're not covering it.
So that's part of what I was talking about earlier is the medical care that you would need after that should be covered by MiCare, right? It's just if you medically need that care, then it should be covered. The thing that we still need to figure out is how to sunset or otherwise end that car insurance, healthcare coverage thing that got really messed up when the auto no-fault reform happened that Mayor Mike Duggan was really pushing. And so that's part of what we still need to figure out and figure out how to sunset that stuff. But the care that you would need, you should have already been able to access under a world in MiCare. Do you know who your state rep is? Is it Mike? Okay. Let's talk afterward about this specific case too, a little bit.
Is there another state in the country right now that's operating something like this?
No states are operating a universal single payer healthcare.
Would there be any way as a stopgap for Michigan to just allow people to buy into Medicaid or Medicare? I have private health insurance, and my brother's on Medicare through disability. He has way better health care than I have. I would buy into it. I would pay whatever I'm paying right now into Medicare if I could.
So Medicare is operated at the federal level, so it would be the feds that would have to create some sort of option for you to buy in, potentially. I mean, that's, yeah, but if you're buying into Medicare. Well, you also wondered about buying into Medicaid. There are some health economists that talk about allowing people to buy into Medicaid. A lot of providers are wary of that because Medicaid, the one for lower income folks, does not pay as much for services. Remember I said there's commercial payment and then Medicare and then Medicaid's way down here. So there's problems with that, but Medicaid is administered at the state level. So there is some world in which somebody could introduce a bill. Allow and for Medicaid, but that is not what I'm proposing, and there's no state that really has that specific option either. Yes.
Unfortunately, there's a lot of healthcare that is being highly politicized right now. For example, gender affirming care, which has saved my life. How is this going to be protected in this program from political pressure for specific care?
So the bill drafter, me, thinks that gender affirming care is medically necessary care, and therefore when I talk about medically necessary care, it includes gender affirming care. It is not listed in the brochure here, but it is something that is included as medically necessary care, and the people who determine whether it's medically necessary are the patient and their provider, not me or MiCare.
It's also technically covered by Elliott Larson, so the provider is supposed to provide that. The problem that a lot of providers are having right now is that they're getting pressure from the feds, and so they're breaking the law. Technically, they're breaking the law here in the state of Michigan because Elliott Larson protects that. When we passed and added LGBTQ rights to and protections to the Elliott Larson, that would cover that. And so the hospitals and the facilities that right now that have stopped doing it are technically breaking the law, which the Attorney General, I believe, is working on something having to do with that. I know she's put some pressure on them. They're getting pressure from the feds as well, because they get a lot of federal dollars, so it's a really nasty mix right now, so.
Thank you. Yes.
Hello, everyone. So I'm here, I'd like to ask a question. So I have like 2 young children and my wife. So like right now, they're not getting covered by state Medicaid. And just wondering like what are the like opportunities? Like is right now the marketplace or for my work, what I bought is like way too expensive. Like over 700 in like in a month. I feel it's way expensive than normal average people. So what are my options? Like what can I look into for? Right now, my young 2 children, at this point, they don't have coverage. So just wondering what are my options.
So this is a specific type of case where we can work with you individually on like a specific case. There are a lot of people right now who are losing coverage because either their employer is dropping coverage or they were on a plan that was on the healthcare marketplace. We've heard from others today that had that. And those premiums have skyrocketed in part because of the discontinuation of enhanced tax credits for that under the One Big Bullshit Bill. So that One Big Bullshit Bill cut those tax and enhanced tax credits for your premium assistance. And a person qualifies for Medicaid in Michigan if they're under a certain income level. So I don't want to make you like talk about personal details more than you already have, but we should come talk to us afterward and we'll figure out who is your state lawmaker that can help you talk to the Department of Health and Human Services in Michigan. There is
I don't know what is wrong with this.
I don't know why.
I don't know, okay, there is there is a chance that you may not be eligible for any coverage that is actually affordable right now in Trump's America.
Hi. So really quick on this bill, I totally agree and understand having a board that decides coverage details. However, with that, do you think it would be, I personally think it would be helpful, and would it make sense to put like a coverage still like core package into this bill of certain like things that should be in there, as well as like language, kind of making it really difficult because yes, I know it's like 7 and 7, right? And we're trying to make sure it's going to be even, but I think 99.5% of things with people sometimes are politically motivated, so I don't trust them all the way. Is there a way to put in the bill that they're not able to narrow that coverage? Like if there's political shifts, things like that on that board.
Yeah, so what you're asking for is the bill, the law itself to outline a minimum, right, of what's protected. There is already a minimum list of categories, and that is what is in the brochure. We copied that directly from the bill. So this is parallel to the Affordable Care Act, which lists 10 essential health benefits. And one of them is like rehabilitation and habilitation services. It doesn't say what that means. It doesn't say what services. It doesn't say physical therapy. It doesn't say speech. It doesn't say anything specific. Each state has to implement what it means in that state to meet those 10 federal bill essential health benefits, right? So our bill is kind of mirroring that with this list that's in the bill already, but it by law would be the minimum that has to be covered. It would require future legislators to change that law. And if they're changing it to take something away from people, you bet your bippy people are gonna be out in droves saying, don't you dare. So we are putting things in there that are a bare minimum like that. Yeah. Thank you, great question. It is 4 or 5 minutes before 7:30. Does this go to 7:30? Okay, so we do have a question from online. Just to understand / clarify, would all other payers no longer exist in Michigan? Yes, that's the intention. That is what we are trying to do, make it unnecessary for them to have to exist. You should not have your health care paid for by a company that wants to profit off not giving you care. If you have the state and the taxpayers helping pay for this, the money is accountable to the people, and the people are gonna want their care. So the intention is to have no need for those insurance companies, which, back to your question, is why, yes, we'll have a lot of people lobbying against this, but there's more of us than there are of them. Just don't forget that ever. There's way more of us. So question in the back.
It's me again. Okay, so quick story. All last year, I was working in a full-time job, benefits, we were fully covered, dental, vision, the whole deal. And then they closed one of their stores. I got bumped down to part-time. I was gonna lose my benefits if I stayed there part-time. And so I was left with either work part-time or I could really afford anything, lose my benefits regardless, or go to a job that offers no benefits, but still full-time and gives you a full-time paycheck. So since November? Since December, we've been without benefits until hers kick in. So if this system were to go into place, if people find themselves displaced from a full-time position to part-time position and losing their benefits, this network would not abandon them, right?
For people in between jobs?
Yeah. No, so you would be on MiCare whether you're working, whether you're not. You'd be on MiCare between jobs. You'd be on MiCare as you're starting a new business yourself because you have an idea that you've never had the risk to take because you need your health insurance for your kid, right? Yeah. This would be an economic boon for our state.
Or not to say it a horrible job.
Have you explained to some of these naysayers that, about 20, 30 miles down in Detroit, you cross a bridge or a tunnel, you enter a country where they have this national system that's actually worked for since the 30s, because when Tommy Douglas installed it.
And don't listen to the scare tactics. I know a lot of people from Canada, I know a lot of Canadians that absolutely love it, and yet all we ever hear are the scare tactics about long lines and all this other stuff, and it's like, well, they seem to love it, all the people I know, so.
And even the ones that complain about it still say, I would never give it up, why would you ask me to do that, eh?
Well, it is almost, that clock is behind my, okay, great. But there's a couple more things I want to mention. If you yourself want to be involved in MiCare, if you want to invite us to come do a listening at like your book club or your church or whatever, please contact us. We love doing that. There's also a QR code in the brochure if you want to sign up and officially be like a supporter of MiCare. In the next few months, we're going to be starting to do some fundraising to do a Michigan-specific study that will determine how much it would cost. Right now, we spend over $80 billion total in our healthcare system. $80 billion is our GDP in the state of Michigan on healthcare. And so what we think is that converting from multiple competing profiting payers to one payer being accountable to the people of Michigan with MiCare will save like at least 15 to 20%, but we need an actual study to figure that out. So we'll be starting to raise that. Oh my goodness gracious, this microphone. So hopefully we'll be, so stay tuned for that announcement if you want to be able to chip in to figure out how much this will cost. So then once we have the numbers, it's really hard to argue the math.
So, do we have one more question? Okay, go ahead.
Just one question. I have been hearing a lot about ICHRA, ICHRA, in other states in Indiana, and it's basically a employer-funded employee choice. You have to go through the ACA to.
Is this a co-op plan, like an association health plan?
No. It's Indiana. It has started to do it.
So I do not know immediately what you're talking about. INCHRA. ICHRA, Individual Coverage Health Reimbursement Arrangement, is an employer-funded tax-advantaged health benefit that allows businesses of all sizes. This is the AI, so it could be wrong. Just saying.
That's
so
pretty much what it is. That's pretty much what it is.
So what I'm proposing is not that.
No, I
Okay.
can understand that, but I've been hearing a lot more about how it's gaining some political traction in other states like Indiana, and I'm wondering, is that something you're going to have to kind of fight against here?
So my philosophy is that we need to simplify how we pay for healthcare. We don't need to be adding health plans like this. So.
Thank you. I wanted to make you aware of ICRA if you hadn't heard of it before, and also to just get a comment on how you're thinking about it.
Thank you.
So it is 7:30 or awfully close to it. So I again want to thank everybody for coming out. This has been very beneficial for me because I've also learned. Yeah, I've also learned quite a bit. I would like to thank Senator Chang for participating as well. And yeah, you have a question? No. I'd also like to thank Representative Rheingans for coming and talking more about her legislation. So, again, thank you all for coming out. If you are one of my constituents, feel free, even if you're not, you can reach out to my office. We'll help you if we can. But there's information on the back table back there. There's lots of booklets that are very helpful that your tax dollars pay for the state to produce. So please, they're very helpful. And then there's also contact information for my office if anybody has any questions, or if you have a problem finding the link for the bill. Again, we will post that on my social media, but again, if you don't find it, just reach out to my office. We're happy to email it to you. So.
And just in case nobody says it enough, we cannot do our job without our staff. So thank you to my staff. I have 2 staff online who have been watching the comments, and Mike has 2 staff in the back too.